Hi everyone, Dr. Susan Brown at the Center for Better Bones. You know, people often ask me if I have an inherited type of osteoporosis. In other words, if my mother had osteoporosis or my grandmother, will your Better Bones program work for me? And I want to say yes, the Better Bones, Better Body program is extremely important and very helpful for those people who feel that in their family there's a genetic tendency towards bone weakness. Let's just talk a couple minutes about this whole genetic testing. Remember, when we talk about bone, we're talking about a few different things. One is bone mineral density, and that's today how we've come to define osteoporosis, even though I don't think it's the best definition of osteoporosis. But there is a link between if my mother had low mineral density, there is a chance perhaps 40% or 50% of the chance of having bone mineral density is influenced by a parent. So you have a 40-50% of having low bone mineral density as we measure it today if your mother, let's say, had low bone mineral density, or even your father. So bone mineral density, there is some genetic link. That does not mean you have to fracture, but it means that you're going to have a lower density, which usually means a lower bone size. Remember, as we measure bone density today, it's very related to bone size. The bone density machine doesn't really measure density, it measures area. It's very influenced by area, so it's a measure of size. If your mother's small bone, it's likely you're going to be small bone, but you do not need to fracture. And you might say, well, then I have a genetic tendency towards smaller bone. I maybe have a greater genetic tendency to fracture. So all the more reason you do every single one of the 6 steps of the Better Bones, Better Body program to really strengthen your bone. Now the other aspect is fracture. So you say, okay, so what if my grandmother fractured? Like in my case, my grandmother fractured. What if my grandmother fractured? Or what if my mother fractured? Does that increase my risk for fracture? And again, we see that there is an increase in risk, perhaps even a doubling of fracture risk if your mother, your father, your grandparent has fractured, particularly your mother. So we want to pay special attention to that. If you say, yeah, my mother fractured, she was age 80, whatever, you want to pay special attention. Now, if you look at it, you may find that your mother was never tested for vitamin D, your mother had other health problems, your mother actually did not understand about the importance of exercise. We know much more than our parents did. Nonetheless, if your mother has fractured or your father has fractured, your grandparents, there may be some genetic tendency to have a certain weakness in bone. So pay attention to every single step of our program. It's just another opportunity, like a wake-up call to say, I should be serious about my bone health. Now remember, everything we do at the Center for Better Bones is not only good for bone, but it's good for the entire body. So we can sort of thank our parents for this tendency because it's going to cause us to be a little more careful with our lifestyle and how we handle our life in order to build lifelong bone strength. You can do it. Let's all do it. Let's build strong bones for life, even if we have a history of our parents or grandparents having bone health issues.